There is a line pressed into the skin above your ankle right now, a pale crease left behind by your sock elastic. And if you press your thumb into the soft tissue just above your ankle bone and hold it there for 3 seconds, the small dent that remains after you lift your thumb tells you more about what is happening inside your body than most routine checkups ever will. That indent is called pitting edema, and for the majority of people over 60 who have it, the explanation they were given is almost certainly incomplete. Fluid is collecting in your lower legs right now, quietly, gradually, following the path of least resistance into the loosest connective tissue in your body, the soft matrix surrounding your ankles and the tops of your feet. By evening, you may be carrying an extra half-liter there. By morning, after hours of lying flat, most of it retreats, and you feel almost normal again, until you have been upright and sitting for a few hours, and then it returns as reliably as the afternoon light. You have probably been told this is a salt problem, or a heart problem, or simply something that happens with age. In most cases over 60, it is none of those things primarily. It is a drainage problem. And the drainage system responsible is one that your doctor may have never once mentioned to you by name. The conversation I have had more often than almost any other in 20 years of rehabilitative and preventive medicine is the one where a patient in their late 60s or 70s sits across from me, lists off the medications they have tried, the dietary changes they made, the appointments they attended, and then says something like, "Nothing actually worked and nobody explained why." That conversation is the reason I want to walk you through exactly what is happening inside that ankle and what 5 minutes before bed can do that a diuretic prescription often cannot. Your body runs two separate circulation systems in parallel. The first is the one everyone knows. Blood, arteries carry oxygenated blood outward from the heart. Veins return deoxygenated blood back to it, and the whole operation is powered by the most reliable pump in the known world, your heart, beating roughly 100,000 times a day without any conscious effort from you. The second system has no pump at all. It is called the lymphatic system, and understanding this single fact changes everything about how you interpret swollen ankles. Lymph fluid is a thin, pale, slightly yellowish liquid that seeps continuously out of your smallest blood vessels, your capillaries, into the surrounding tissue. Its job is to bathe your cells, collect the byproducts of cellular activity, sweep up dead bacteria and excess protein, and carry excess water back out of the tissue and into a parallel network of vessels that eventually returns everything to your bloodstream near the collarbone. Your body moves roughly 2 liters of this fluid every single day. And the only thing that moves it is you. Every contraction of your calf muscles, every rotation of your ankle, every step you take. Each of these physical elasticity physically compresses the lymphatic vessels in your lower leg, squeezing the fluid upward through a series of one-way valves toward the larger lymphatic trunks in your thigh, your abdomen, and finally your chest. Stop moving and the fluid stops moving with you. Think of it this way. If your bloodstream is a river with a dam providing constant pressure, your lymphatic system is an old-fashioned canal lock. It requires someone to manually operate the gates, and that someone is you. When you were 30, this was not a meaningful problem. Your lymphatic vessels were elastic. Their one-way valves snapped shut cleanly after each contraction, and your connective tissue in the lower leg was firm enough that excess fluid had nowhere comfortable to pool. A few hours of sitting might produce some mild puffiness, but one decent walk would clear it before dinner. After 60, 3 changes arrive at the same time and compound each other. The walls of your lymphatic vessels stiffen, losing the, elastic recoil that helped them spring back after each compression. The tiny valves within those vessels, hundreds of them in each leg, each one a delicate flap of tissue no thicker than a petal, begin to close less completely, allowing small amounts of fluid to drift backward between contractions. And the connective tissue of the lower leg gradually loosens, creating more physical space for fluid to settle and accumulate. The result is a system that leaks faster and drains slower in a location that already depends on fighting gravity all day long. Not a disease, but a mismatch between the demands placed on an aging drainage system and the movement it actually receives. Before I go any further, I need to pause and be direct with you about something important. There are patterns of ankle swelling that are not about the lymphatic system at all, and they require a doctor's evaluation, not a YouTube video. If one leg is suddenly and significantly more swollen than the other, and that leg is warm to the touch, tender when you press it, and the skin looks red or mottled, call your doctor today because that combination can indicate a deep vein thrombosis, a blood clot that can be dangerous. If your ankles are swelling along with shortness of breath, especially if you find yourself propping up your head with extra pillows to sleep or waking up in the night feeling like you cannot catch your breath, those symptoms together suggest the heart is under a degree of strain that needs evaluation, not management at home. If you have noticed rapid weight gain over a week or two alongside the swelling, and your urine looks foamy or unusually dark, your kidneys may be losing protein. A blood test this week, not next month. If any of those situations sound familiar, close this video and make the call. For everyone else, gradual symmetrical swelling that builds through the day is worse by early evening and largely resolves overnight. What follows is for you. There is a clinical sign I want you to try right now on the top of your foot, not the ankle. Place your index finger and thumb on the skin that covers the bones across the top of your foot, the area just behind the knuckles of your toes. Try to lift a small fold of skin between your fingers, the way you might pinch the back of your hand. In a foot where lymphatic drainage is working well, the skin on top lifts easily, loosely, the way the skin on the back of your hand does. In a foot where lymphatic stagnation has been present for months or years, the skin becomes progressively thicker and indurated, hardened from the inside by proteins that accumulated in the fluid and were never fully cleared. And that fold of skin becomes impossible to lift. It sits flat and firm no matter how you try. In clinical settings, we call this a positive stemmer sign, and its presence tells us that the drainage problem is not new and not minor. If you cannot pinch that skin fold, your lymphatic system has been working overtime and losing the battle for quite some time. Now I want to talk about something a woman told me that I have thought about many times since. She was 71 years old, a retired librarian who had been dealing with ankle swelling for 4 years by the time she came to see me. She had seen her cardiologist twice, had been on and off diuretics, and had eliminated salt so aggressively that her meals had become, in her words, punishing. And still, every evening, her ankles looked like two small balloons tied at the base of her legs. She looked at me and said, with genuine exasperation, "I did everything they told me, and my body just kept refusing." That sentence stayed with me because the problem was not that her body was refusing. The problem was that she'd been treating the wrong compartment. Diuretics pull water out of the bloodstream, making the kidneys excrete more sodium and water via urine. But the water in her ankles was not in her bloodstream. It was in her tissue, the interstitial space between her cells, downstream of her capillaries, waiting to be collected by lymphatic vessels that were not moving it fast enough. A diuretic cannot reach that tissue compartment directly. So treating the bloodstream while the real bottleneck was clearance speed meant she was managing the wrong problem entirely. Clearing the tissue requires movement. Specifically, it requires a repeated rhythmic contraction of the calf muscles, which physically wrap around and compress the lymphatic vessels in the lower leg, the way you would squeeze a soft tube to move liquid through it. The soleus and gastrocnemius, the two main calf muscles, muscles, act as a peripheral heart for your lower legs, and when they are not contracting regularly, your lower body is running without its pump. Three things accelerate the buildup significantly after 60, and most people are doing at least two of them without knowing it. The first is hidden sodium, not the salt you add at the table, but the sodium in foods that do not taste salty. Bread, cheese, deli meat, canned soup, frozen meals, condiments, restaurant sauces. Sodium pulls water out of the bloodstream and into surrounding tissue through osmosis, and the body retains roughly 1 cup of fluid for every half gram of excess sodium consumed. Most people over 60 are taking in double what they estimate. The second accelerant is evening stillness, the hours between 7 and 10 at night when you finally sit down and your calf muscles go completely quiet. 3 hours of stillness after the largest meal of the day creates the worst possible conditions for overnight drainage. The third is alcohol, even in small amounts. A single glass of wine in the evening dilates your capillaries, slightly increasing the rate at which fluid leaks from blood vessels into tissue, and suppresses a hormone called ADH, antidiuretic hormone, that normally signals your kidneys to slow urine production at night. The result is that your kidneys underperform during the overnight hours when you most need them to be clearing fluid, and you wake up with more retained fluid than you had before the drink. Now let me walk you through exactly what to do about this. And I want you to do this with me, not just listen to it. Before your legs touch the floor tomorrow morning, while you are still lying in bed, bring both feet up toward the ceiling slightly. Flex your feet so your toes point back toward your face, then push them away, pointing your toes down toward the foot of the bed. Do that 30 times, slowly, feeling the full range of motion in your ankle joint on each repetition. This takes under a minute, and it matters disproportionately because the first act of standing in the morning sends blood rushing into your lower legs under the full force of gravity into tissue that has been lying flat all night and is not prepared. Priming the lymphatic pump before you stand prevents that initial surge from overwhelming a system that is just waking up. During the day, for every hour you sit still, stop and do 20 heel raises. Heels flat on the floor. Lift your toes up toward your shins, then lower them slowly. 20 times, 30 seconds. Set a quiet alarm if you need the reminder. This is not exercise in any meaningful sense. It is just the minimum signal your lymphatic system requires to keep the fluid moving rather than pooling. Now here's the part that matters most, and I want you to stay with me through the detail because each element does something different. 90 minutes before you go to sleep, find a clear stretch of wall. Lie on your back with your legs extended up the wall so your heels rest against it and your body forms an L shape. Your legs should be roughly perpendicular to the floor. Not perfectly, it does not need to be perfectly. Just enough that your ankles are above your knees and your knees are above your hips, and your hips are roughly at heart level. Stay there for 15 minutes. In the first 5 minutes, do slow ankle circles. 10 rotations clockwise, then 10 counterclockwise. Then alternate foot flexes, pointing and flexing each foot 20 times. Feel the slight pull along the back of your calf as you flex. That tension is the soleus engaging, which is exactly what you want. In the next 5 minutes, place both hands on your abdomen, just below your navel, and breathe in slowly through your nose for 4 counts, letting your belly rise under your hands. Not your chest, your belly. Then breathe out slowly for 6 counts. Repeat this 10 times. This matters because the main collecting trunk of your entire lymphatic system, the thoracic duct, runs directly behind your diaphragm, and diaphragmatic breathing physically massages and propels lymph through it with every breath cycle. You are actively pumping, not just resting. In the final 5 minutes, remain in position and simply rest. When the 15 minutes are done, roll to your side, sit up slowly, and do this next part carefully. Starting at your ankle, use the flat surface of your finger and not just the tips, the whole finger pad, and stroke the skin upward along your calf with gentle, firm pressure, the way you would smooth wrinkles from a sleeve, always upward, always toward the heart, never down. 10 slow strokes on each leg. This manual movement physically displaces fluid from the interstitial tissue into the openings of the lymphatic capillaries, which are just beneath the skin surface and respond to very light pressure, far lighter than most people expect. Within 10 to 15 minutes of the sequence, most presiu, Wostiu, Guailaspo, feel the need to urinate. And when they do, the urine is pale, clear, and notably more voluminous than usual. That is the fluid that was sitting in your ankles since afternoon, and you have cleared it while you're awake, on your schedule rather than being woken by your bladder at 3 in the morning to deal with it. I want to tell you about a man I saw about 2 years ago, 66 years old, recently retired from a desk job he had held for 30 years. He came in because his wife had told him to stop ignoring his ankles. He was the kind of patient who minimized everything. He described his swelling as a slight inconvenience and his footwear as just adjusted for comfort, which meant he had quietly bought shoes 2 sizes wider without ever mentioning it to anyone. By the time I saw him, his stemmer sign was clearly positive. The skin on the top of his foot was tight and immovable. He had been in this state for at least 18 months. We started him on the evening protocol described above, with one addition. Compression stockings in the morning before standing, applied while still lying down, removed in the evening before the legs up the wall sequence. He came back 6 weeks later and I asked him how the mornings were. He thought about it for a moment and then said, I stopped checking. He meant he had stopped pressing his thumb into his ankle every morning to see how bad it was. The habit had simply become unnecessary. That is the kind of change that does not show up on a lab result or an echocardiogram, but it shows up in a person's life in ways that are completely real. There is a sentence I want you to write down or photograph right now, so you have it at your next appointment. Say, my ankle swelling is worse in the evening and better in the morning, and I have not had shortness of breath with it. Is this primarily a lymphatic drainage issue rather than a cardiac one? And would compression therapy be appropriate to try? That question shifts the frame of the conversation, tells your doctor you have thought about mechanism rather than just symptom, and opens the door to a referral to a certified lymphedema therapist who can assess your specific pattern and teach you a manual drainage technique tailored to your own anatomy. I want to hear from you. Leave a comment right now with one word describing how your ankles feel by the end of a typical day. Just one word. I read these. There's something a patient said to me years ago that I come back to whenever I explain this topic. She was 69, a woman who had spent most of her adult life running a small bakery, standing on concrete floors for 12 to 14 hours a day for decades. And her lower legs had paid the price. By the time her daughter persuaded her to come in, her ankles were visibly thickened, even in the morning, and the skin above them had taken on that brownish, slightly leathery quality that suggests chronic congestion in both the venous and lymphatic systems together. She was certain the damage was permanent, and she told me so plainly. I used these legs hard, and now they're done. We worked with her over 3 months. Consistent movement, the evening protocol, compression garments applied each morning while still lying down, dietary adjustments focused on protein and fluid timing rather than salt elimination alone. At her final appointment, she pulled up her trouser leg without being asked, looked at her ankle for a moment and said, "They look like they belong to me again." That is not a cure. Her lymphatic vessels still carry the stiffness that comes with age, and her valves are not new. But the fluid balance had been restored to something her body could actually manage, and that shift was enough to give her back a version of her own legs that she recognized. When the body's drainage is working, the energy that went into managing fluid, the heaviness, the tightness, the disrupted sleep, the midnight bathroom visits, returns to you. You move more easily, sleep more continuously, and your body spends its overnight hours on repair rather than fluid management. Understanding your lymphatic system is not a minor adjustment to your health routine. It is understanding the operating system that your circulation, your immune response, and your tissue health all run on top of. When that system gets what it needs, movement, hydration, elevation, the brief manual assistance that 15 minutes of intentional practice can provide, the results are not subtle. They appear in the way your shoes fit in the evening, in the crease your sock leaves or does not leave, and in what you see when you press your thumb against your calf and watch what happens next. To bring everything together before you go, for most people over 60 without cardiac symptoms, chronic ankle swelling is a lymphatic clearance problem. A system that moves only when you move, running in a body that moves less than it once did. You can support it with consistent calf activation throughout the day, with an evening protocol of elevation, diaphragmatic breathing, ankle movement, and brief upward massage with adequate protein and hydration with reduced hidden sodium and with compression applied in the morning before you stand. Bring this question to your doctor, whether compression therapy and a lymphedema specialist referral make sense for your specific situation. If you are currently experiencing sudden or one-sided severe swelling, shortness of breath, or any combination of symptoms that feel new and escalating, consult your physician before anything else. This content is general health and wellness information provided for educational purposes only. It does not constitute personal medical advice, a diagnosis, or a treatment recommendation. Every person's anatomy, medical history, and current health situation is different, and the information presented here may not apply to your specific circumstances. Before making any changes to your diet, exercise routine, or health practices, and especially if you are currently experiencing pain, a diagnosed medical condition, or are taking prescription medications, please consult your own physician or a qualified healthcare provider who knows your full medical history